We shall next talk about some miscellaneous topics in urology. We're now on begin number 27. A 72-year-old man consults you with a history that for the past several days he has noticed that bubbles of air come out along with the urine when he urinates. He also gives symptoms suggestive of mild cystitis. Well, this is a classic and you can diagnose it instantly. When we have this history that there is air coming along with the urine, we know there is a connection between the urinary tract and the GI tract. Most frequently it's going to be from the sigmoid colon to the dome of the bladder. And most frequently the disease will be diverticulitis, with the second most common being a cancer of the sigmoid eating its way into the dome of the bladder. It's very rarely a bladder cancer eating its way up, very rarely. And we make our diagnosis first with a CT scan. And the CT scan shows us a big inflammatory mass of diverticulitis. But before we do the operation to separate the two, we do a proctosigmoidoscopic exam. Because remember, the second potential reason for one of these is a cancer of the sigmoid. We don't want to miss that. We want to know that ahead of time before we operate. And then in the operation, of course, we remove the segment of the bowel that has a disease, typically diverticulitis, and repair the two organs and put some living tissue in between them so that two suture lines don't end up next to each other where there would be a possibility of fistulization again. Now the next few vignettes deal with erectile dysfunction, impotence. Before I read the vignettes, let me give you some general ideas about impotence. I'm going to do this first, just chatting with you, and then I'm going to show you screens with words that remind us of the same issue, and then we look at the vignettes. Impotence could be related to trauma or unrelated to trauma. If it is related to trauma, the trauma in turn could be trauma to the perineum, in which case the injury is typically a vascular injury, amenable to a vascular repair. Or the trauma could be radical pelvic surgery, like an abdominoperineal resection, in which case, unfortunately, the trauma is to the erectile plexus, to the little nerves, and they cannot be put together again. Impotence, on the other hand, could be unrelated to trauma. If it is unrelated to trauma, there are again a couple of variants. Impotence may be psychogenic. If it is psychogenic, it typically has sudden onset, and once it happens, it's very specific, limited to circumstances similar to those that led to it in the first place, but there is a still normal erection under different circumstances. Or it could be, rather than psychogenic, organic, and the organic impotence, which is the most common one we see, is what we see in the older male who perhaps is on antihypertensive medications or who has some degree of atrophy of the testicles and so on. In that setting, the diabetic, the hypertensive, etc., in that setting, typically the onset of erectile dysfunction is very gradual. At first, the patient still has erections, but they don't last as long as they used to. At a later stage, the erections do not have sufficient quality to allow intercourse. And as the disease progresses, eventually to the point of no erections whatsoever, we find that this is a universal phenomenon. It's not affecting only the relationship between two people attempting to have intercourse, but it affects nocturnal erections as well, the ability to have an erection with masturbation and so on. So with that background, let me review a few vignettes and then we'll remember this whole thing one more time with a little set of screens with words. So let me read vignette number 28. A 32-year-old man has sudden onset of impotence. 1 month ago, he was unexpectedly unable to perform with his wife after an evening of heavy eating and heavier drinking. Ever since then, he has not been able to achieve an erection when attempting to have intercourse with his wife. But he still gets nocturnal erections and can masturbate normally. Well, obviously, this is psychogenic. It has all the characteristics of psychogenic impotence. And this can be treated with psychotherapy, but I have to add, only if promptly done. Men are very touchy about this issue. If a man is allowed to remain impotent for several months before an attempt is made to reverse the situation, it may be too late to do it. All right? Let me move on to the next. Ever since he had a motorcycle accident where he crushed his perineum, a young man has been impotent. Well, you recognize this from the review we had a minute ago. This is probably a vascular injury. Could be the pudendal artery. And you could do an arteriogram here, identify the injury, and do a vascular repair and restore function. But you will not be able to do that on vignette 30. Ever since he had an abdominoperineal resection for cancer of the rectum, a 52-year-old man has been impotent. We know in that case the injury was to the erectile plexus, the little bitty invisible nerves that we deal with when we do that kind of radical pelvic surgery. This cannot be reconstructed. And a prosthetic device is about the only help that could be offered here. And finally, vignette number 31. A 66-year-old diabetic man with generalized arteriosclerotic occlusive disease notices gradual loss of erectile function. At first, he could get erections, but they did not last long. Later, the quality of erection was poor. Eventually, he developed complete impotence, and he does not get nocturnal erections. A classical sequence for organic impotence that is not related to trauma. A wide range of therapeutic options exist, but this is the type of erectile dysfunction that has yielded excellent results with the use of the newly available agents that help maintain erections by blocking the enzymes that eliminate the vasodilation that leads to the erection in the first place. And that began with a famous Viagra and now has a number of other similar drugs. Because the USMLE prefers the use of generic names for the drugs rather than brand names, in your notes I specified that the drugs that would be expected to be very useful here are sildenafil, tadalafil, or vardenafil. Sildenafil was the original one, Viagra. Well, let's look at these things again with screens full of words. So a little review again of impotence, erectile dysfunction. If it follows trauma, and the trauma was to the perineum, it is probably a vascular injury amenable to repair. If it follows radical pelvic surgery, it is probably neurologic damage. Repair is not possible. If the erectile dysfunction that is depicted on an exam question is unrelated to trauma, if it had sudden onset at very specific circumstances, with function preserved in other settings, it is psychogenic, amenable to psychotherapy, but it has to be done promptly. If, on the other hand, it has gradual onset and it is universal, affects erections under any circumstances, then it is organic impotence that could respond, and often does respond, to sildenafil, tadalafil, or vardenafil. And this is the end of the miscellaneous chapter in the urology chapter.